So why do I think that the development or the worsening of macular edema after a cataract surgery in diabetic patient is way more frequent than we think? Well, it is for many, many reasons. And the first one is that probably is not well known that the only diabetic eyes that have no risk of worsening or developing an edema are those eyes that have no signs of retinopathy or maculopathy, no microaneurysm, no exudates, nothing at all from the macula and from the retina. And this is the only category of eyes. All the other do have a risk of developing or worsening. We all know that the risk of worsening of edema is very high when DME is already present before surgery, but what we probably don't know is the percentage of the eyes that worsen. And according to literature, is as high as 100%. Almost all the eyes that have an edema before will worsen after. But these are not the only eyes that will have an edema. Also the eyes that have just microvasculature abnormalities, a blood retinal barrier anomaly, even if they don't have any edema, they do have a risk of developing edema, and the risk is as high as 56% according to literature. So the percentages are really, really high. And two other questions to remember is that this edema is not going to develop right after the surgery, but it's going to take even to 16 weeks after surgery to develop. And so it's not visible right after to the surgeon. And the second thing is that it's going to be probably permanent because blood retinal barrier is already weak. And so this inflammatory insult will probably remain forever. And the last question is about the numbers. This is the most striking question. It has been estimated that more than 20% of our cataract procedures are performed in diabetic eyes. And this number is going to increase to the incidence of the diabetic population in our countries. And this, for example, means that just in Italy, where we perform more than 500,000 procedures every year, I would say that more than 150,000 procedures are performed in diabetic eyes. And because these are older guys with probably type 2 diabetes for a long time, they all are potentially at risk of developing or worsening. So the numbers are incredibly high. So the take-home message is when you perform a cataract surgery in a diabetic patient, remember that only the eyes that have no signs of retinopathy or maculopathy have no risk. And the key factor is the prevention. And this prevention has to cover a time window of 3-4 months after surgery. So the therapy would consider 4 monthly injections of anti-VEGF, or better, what I personally do, an intra or preoperative single injection of slow-release dexamethasone or sluggy triamcinolone. Thank you so much.
Thank you very much. Absolutely, couldn't agree more, but I might disagree with the first take-home message conclusion because some of the diabetic patients, long-standing diabetes of 10 to 15 years with no retinopathy, they are still at risk of developing macular edema. Yes, no matter what you do, there is an incidence, even if they have absolutely no retinopathy.
Absolutely nothing, yes.
Right.
Literature say that also.
Ferenc?
Do you advise us to do anti-VEGF 1 week or a couple days before the cataract on diabetic patients?
I would say no, because it is an off-label procedure. It is written when you buy an anti-VEGF, whatever you do, it can be injected in the 30-day postoperatively. So you can start 30 days after the procedure.
In diabetic patients going for cataract, I sometimes inject 1 week before the cataract surgery, ranibizumab or.
Well, the things that we all do to avoid this complication are many. So we can do many things. My opinion, the best thing is because an inflammatory agent, a long-lasting inflammatory, is steroid.
Thank you very much. Okay. A question here? Okay, last question.
Quick comment on the first statement. We published a study in Ophthalmology 2015 and 81,094 eyes had cataract surgery. We found that the reference group, not diabetic, the relative risk of macular edema was 1.17. If you have diabetes, no retinopathy, the relative risk is 2.5%. The relative risk in PDR is 12.07. So even diabetes, no retinopathy, they are at risk.
Yep.